Commerce. But the little that I do, I think will benefit from this kind of teaching. So once again,
we are reproductive society for AIDS in Africa, and one of our core mandates is to take care of our constituency, especially people living in HIV, and also to take the best system in Africa. And we know that with COVID-19, there's a lot of disruption in the system. Most of the funding that we're going for COVID, so for HIV now, are using for COVID. And we know the hardship that our people are facing. Even to buy those flats is not easy. This is why with the High Commission of Canada and UNFPA, we came from the Society for East Africa to bring the skills for our professional people. We have started this domain since the outbreak of COVID. We did it in Military Hospital 27, and now we are doing it for the and we continue doing it until we strengthen the system with our people. Thank you so much for being our host and to support this program. We really appreciate it. Thank you.
On behalf of the previous units of Korle Bu and the workers, the chief executives, and the head of the unit, we wish to express our profound gratitude for the help that UNFPA have rendered this morning. We know we are not the only people who have benefited, but at least we are very happy for the help that they've been offering and have offered this morning. So we want to say a big thank you for your presence and for even thinking about us and coming all the way. God richly bless you.
Thank you. Really appreciate it.
These items are items that are everyday use for our patients. Just like you can see these things in this pandemic era, everybody would have to secure some for himself or herself. But we know the status of our patients, and it's very hard for them to come by some of these things. And so you coming to our aid is just on time, so that they will be encouraged to come, because they know when they come, at least some of these things will be taken care of for them. And so it's going to go a very long way. And additionally, we all know of their immune suppressed status, and this is not a time to add on another infection at all. And so it's a very welcome item that is going to help them both in their well-being and in the management that they are receiving in this place.
My name is Mrs. Elizabeth Akua Dzokoto, the head of nursing. Yes, we really appreciate what you've done, because most of our patients are not working, and sometimes we need to supply these things to them, but most of the things are not forthcoming, and you know that the government alone cannot do it. So we thank you very much for what you've done for them. They themselves are very appreciative. They even said it. And as Oliver Twist, will always ask for more. So we are just praying that you keep on doing frequently. Thank you very much.
Kwaku. I'm in charge of the OPD here, and we see pregnant women plus those who have tested HIV positive. Actually, the whole clinic is integrated, so we don't really differentiate HIV positive mothers and those coming to the antenatal clinic. And we are very grateful for your donations, and this will go a long way to help our mothers. Most of them, like the sanitizers and the face masks, they don't really have money to buy them. So since you brought some, we are very, 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 very grateful. It will go a long way to help the underprivileged mothers that we have here. Thank you so much.
I'm Luke Amanbodia, the director of the International Conference on HIV and STI in Africa. and also the coordinator of Society for AIDS in Africa. Today, we are in Korle Bu Teaching Hospital. And being here is a pleasure because we know that since the outbreak of COVID-19 in the world, and especially in Ghana, we have started the program of donation of PPE throughout hospital. We have done it in December 2020. We have done it in 37 teaching hospital. And now we are doing it in Korle Bu. Today what we did is to share at least 500 kits of PPE, to the world, maternity world here. And we also share it with the HIV unit in Korle Bu. We can see that, we like it or not, the COVID impact in our constituency is hard. We have seen a lot of women here having their baby and cannot even pay the fee to go out of this hospital. We come here today just to give them the tokens that we can do. With the support of Canadian Higher Commission and UNFPA, the Society for AIDS in Africa was able to share 500 kits to all the women here and also the personnel. We believe that it will help them to follow up the COVID protocol by keeping distance, by wearing their mask, and by having their alcohol to wash their hands always, This is what we try to do today. You can see in the park, in every park we have toothpicks, we have soap, we have PPE, we have also pad, This just a talking to help. And we believe that if all the organizations, the charitable organization can come to Korle Bu to alleviate the poverty and to alleviate what the women and the general patient are facing here, it will go a long way. We are calling the general public and all the organizations outside there, to come and donate to Korle Bu Teaching Hospital, especially the maternity ward and HIV unit. Thank you so much.